Hello, everybody. This is essentially just a short little video biography detailing my experience as a graduate student and coming from a small town in Roswell and turning into a graduate student at New Mexico State University. So, yeah, this is my story. It's a short video biography, so I hope you enjoy. So, a little about me. My journey started at an early college high school where I earned 2 associate degrees while completing my uh, high school diploma. So, in 4 years, I was able to obtain 2 degrees, one in mathematics and one in biology. And I also was able to get my high school diploma in that time. On top of that, that's whenever I got my first jobs. And I would be 20 hours split. That'd be 10 hours as a micro lab TA and then 10 hours as a IT department. So I really had this like biotech like mixture in me from the beginning, where I'd be doing half my life outside of school, working in a lab, and the other half working with technology. So, yeah. After high school, I knew I wanted to go into biology. I had great professors for biology, and it really gave me a passion. And I've always wanted to help others, and I've gone towards the direction of medicine. But since then, I've kind of more focused to a laboratory role. So after high school, I attended New Mexico Tech in Socorro, where amazing professors like Snezna Rojal, Benjamin Duval encouraged me to push myself and finish my bachelor's degree. And I actually got out early. So again, I got my associate's degree in high school, so I was able to get out of New Mexico Tech with my bachelor's within 2 years. And during the summer breaks, I would work at a pediatric clinic in Roswell, and that was a fun job. I got to do a lot of new things, and it was stressful initially, being a freshman or sophomore, doing all these like procedures on people, not being pretty much just as old as some of the patients I was seeing. So yeah, I had to act really professional, and I gained a lot of professionalism from the people I worked there, and I worked with great clinicians that were amazing people. So after that, I decided, okay, well, biotech looks great. Let's go ahead and keep on this track of going towards that. So I looked around for schools and I saw that there was this program at Mexico State University where I could complete my biotech master's in 1 year. I'm like, okay, great. That gives me downtime to think about what I want to do after I get my degree and where I want to work, what I want to do. Do I want to go to medical school, and so forth. So a little about my education. I'm reiterating this here. I was able to get my associate degrees in mathematics and biology at my time in high school. And then Mexico Tech, I got my bachelor's in biology. Nothing fancy, no focuses there, just simple science, biology, a bachelor's. And then lastly, I got my professional master's, or I'm getting it, hopefully, in see, there's a mistake there. It says May. It should say June 2026, and it will be in biotechnology. And so a little bit more about my work experience. So I've been a lab TA and IT support, as you know. That was my time in high school, which was pretty fun. I got to do a lot of micro prep, so I'd be pouring plates, autoclaving things, such as that, and it wasn't that high stress of a job, and I had great mentors at the time to help me out and really take the time to teach me these techniques, even though I was young at the time. And then I had, of course, my job as a pediatric clinic assistant, and where I'd spend my summers, and I would do stuff like patient charting, vaccinations, vitals, swabbing, and sometimes we'd work in the lab, and I'd have to do testing for COVID, flu, certain bacterias, and whatnot. And more recently, with my time at NMSU, I've become a TA, where I work two positions split as a TA, one teaching a lab and one with a lecture. And then yeah, since I've come to New Mexico State, it's been brand new. I used to live in the dorms, but now I have my own place, and it's been a learning experience to say the least. And lastly, some of my skills and expertise that I like to talk about. I think my clinical and lab skills are definitely my most forward-pressing ones, as well as my bedside manner. I like to think that I'm easy to approach, but I think that depends on the person who you ask. So some of the lab skills I've gotten and clinical skills, we got patient charting, vaccinations, vitals, bacterial plating, flu testing, and then microlab. I also have experience with ELISAs, RT-qPCR now, uh, qPCR, uh, PCRs, all the PCRs, and just general micro techniques I'm very familiar with. And yeah. And then more so than that, I think I'm rather technically inclined in terms of the computer space. I've done IT support, I've built computers, and many uh, other laboratory procedures and such, which is under the technical skills there. And then some of my core competencies is that I've been a TA, I have time management skills, I've multitasked many things, independent financial management. That's more or less just me paying my own bills, and more so than anything, I try to persevere. So looking ahead, after I get my professional master's, I'll be working in a new lab in virology, which I'm really excited about. And I'll be working with West Nile virus, and it's it's a great opportunity and stepping stone for me to make a difference in my career and in people's lives, hopefully. And that's all I want, is to help people. And yeah. So my ultimate goal is to become a scientist who works with a disease. Maybe not necessarily like a doctor, but someone that's working with diseases, wearing the big covered BSL 4 yellow suits, working with diseases. I have a whole bucket list of diseases I eventually want to work with. Yeah. So beyond that, thank you for watching, and I hope you guys have a great day.